Good afternoon, everybody. We'll go ahead and wait till 3 o'clock. I'm showing about a minute away, and then we'll get going. Okay, good afternoon, everybody. I've got 3 o'clock on my phone here, so we'll get going. Looks like Lisa isn't in yet, but I'm sure she'll be joining in just a minute. I'd like to welcome you to this board meeting for November 19th of the Coeur d'Alene School District. I'm going to go ahead and call the meeting to order. Is there a motion to approve today's agenda?
So moved.
Second.
Okay, it's been moved and seconded. And all in favor?
Aye.
Aye.
Aye. I think, was that everybody get a chance to vote there? I'm not sure I heard them all.
I didn't hear the motion.
Oh, hi, Lisa. It was just to approve the agenda.
Perfect.
Okay. We've got, I guess a couple things were scheduled. Well, we didn't have an end time on this, but Rebecca and I have negotiations at 5 o'clock across town that we need to head to. So I'm hoping we can be wrapped up by 4:30 today. And that's going to be pretty much a firm deadline for Rebecca and I. So hopefully we can move along and kind of get our questions asked and answered quickly. Before we go into the main part of the discussion, there's a little bit of cleanup work we have to do just on some of the decisions that we authorized Superintendent Cook to make, or that he made under his authority. And that's in regard to the change at middle school for when we come back, and then the two temporary closures at Venture High School and Northwest Expedition Academy. And so if there's any questions on those, I guess we could do those now. And if not, we just need to make motions just to ratify those decisions.
Do we need to read that whole thing in our packet?
Yes.
So I'll make the motions for consideration. The middle school schedule change to hybrid. Motion to ratify the decision made by the superintendent on November 11th to change the schedule for all middle schools from yellow, 4 days of in-person instruction, to orange blended learning. Half of the students attend in person Monday, Tuesday, and half attend in person Thursday, Friday. Wednesdays will remain remote learning for all students. This change to take effect on November 30th. Venture High School schedule change to remote learning. Motion to ratify the decision made by the superintendent on November 13th to move Venture High School into the red risk level, temporarily shifting all teaching and learning to the fully remote at-home model. Northwest Expedition Academy schedule change to remote learning. Motion to ratify the decision made by the superintendent on November 11th to move Northwest Expedition Academy into the red risk level, temporarily shifting all teaching and learning to the fully remote at-home model with the goal of returning to the current elementary schedule beginning November 30th.
Okay, thank you, Tambra. So we need to just treat those as three separate motions. And so you read them as three separate motions. Is there a second on the first motion regarding the middle school change?
Second.
Okay, thank you. It's been moved and seconded. Any discussion? Okay, so all in favor of the motion on the middle school change?
Aye.
Aye.
Aye. Any opposed? Okay, motion carries. Next up, Ms. Pickford made a motion on the schedule change for Venture High School. Is there a second on that motion?
Second.
Okay, thank you. Any discussion? All right, all in favor on the motion for Venture High School?
Aye.
Aye.
Aye. Any opposed? Okay, and then finally, Ms. Pickford made a motion on Northwest Expedition Academy schedule change. Is there a second for that?
Second.
Thank you. Any discussion? Okay, all in favor of the Northwest Expedition Academy motion?
Aye.
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 Aye. Any opposed? Okay, thank you. So we got through those. So next up is discussion, just kind of where we're at today. And I believe Dr. Cook has several new exhibits he wants to share. And I believe I saw Jeff Lee from Panhandle Health on. So I'm going to go ahead and turn it over to Dr. Cook. And,
Thank you, Chair
here we go.
Morrisroe. Yeah, thank you, Chair Morrisroe. First off, I think part of what we want to make sure we're discussing today is some things about the reopening plan and just the way that we've been administering to this extent. But before we start that discussion, we've invited and asked for Panhandle Health District lead epidemiologist Jeff Lee to come attend our meeting and give us kind of a local update on what's going on in the community and stand for any questions you guys might have. So I'm going to, before we move into our plan discussion, I'm going to ask Jeff to jump on here quickly and just give you kind of a status of the community right now. So thank you, Jeff.
Sorry about that. I had to find the right button. Good afternoon, and thank you for allowing me to come and present to the school board today. I'm going to go ahead and share my screen here. And what I'm sharing, can you all see that? It should be the epidemiology summary. So this is the summary that we used this morning to determine what categories each of the counties are in as far as cases per 100,000 and whether there is community spread. As you can see, there is red across the board. At this point, I'm just going to scroll down here a little bit. This is our graphic presentation. Each of these points is a 7-day average. So we're showing Kootenai County here in the gold has been consistently moving upward, and it is currently at 69.2 cases per 100,000. The other counties are also in the red. In addition, Kootenai Health reported this morning they're at 93% of their maximum capacity, which puts them in red, not their highest category of purple, which they were in yesterday. They were 98% yesterday of their capacity. Right now, they have 49 inpatients with COVID and 14 in critical care. Their biggest obstacle right now, though, is the number of staff that are out either sick or in quarantine. So they have diminished staff capability. And then I'm going to scroll down and show the hospitalization graph. As you can see where my cursor's at, this is us now. This was us over the summertime when we had our second wave of COVID-19. We are seeing a lot more inpatient activity for our hospitals, both in terms of daily frequency and the number of patients that are being admitted. And the trajectory for COVID in our region is moving, moving up and not showing any signs of letting up anytime soon. We are seeing, on average, about 150 new cases per day, to the point where we're having difficulty keeping up with just our data entry of all of the new cases coming in. Scrolling down now to show the positivity rate and to just refresh everybody's memory. Positivity is the proportion of all tests that come back positive. And so when people say, oh, there's more positives because there's more testing, that's not the entire picture. What we're looking at is that proportion that is positive. If that's increasing, we are seeing more cases, regardless of how many tests that we're doing. And we are seeing a lot of positivity. We've been floating right around 20%. As a reminder, 5% is the point where the CDC says it's very concerning. And 20% for our gating criteria for Panhandle Health District is the point where is the threshold for the significant or red level for purposes of gating. So given the fact that the hospital is at a level of their capacity and that our cases per 100,000 exceed the threshold within Kootenai County and actually within the district as a whole for the significant or red level, and because our positivity rate is hovering right there and at times crossing that threshold, we have put the entire district into red. And I'm not sure if you have heard yet, but the Panhandle Health District Board of Health just passed an all-district mask mandate. So that is, there is a mask mandate moving forward. Any questions?
Jeff, I've got one question just about percent positivity.
Sure.
When we're reaching the levels that we've been reaching, 20% here for a few days or longer, is that, in your guys' view, is that kind of an accurate picture of the community, or is that, I've seen some reference, I think from the White House task force, that sometimes those high rates mean that only your sickest people are getting tested and you don't have enough of kind of just mild symptom people getting tested. How are you guys viewing that?
Sure, and that's a valid concern. We're looking at all testing. If you notice the numbers just above the graph for Kootenai Health testing, it breaks it down into excluding pre-procedural, which would tend to be more of the positive people. And then below that, it includes pre-procedural. So these are people that are coming in for scheduled procedures, surgeries, whatever, and they're being tested regardless of their symptom status. And it is, as you can see, at 19.8%, where the folks being tested because they're symptomatic or because they've been exposed and not yet symptomatic is a little bit higher at 20.5% through the testing center at the 2207 building for Kootenai Health. So we feel pretty comfortable now. You know, our testing site that we have at the fairgrounds, they have been testing symptomatic people. That's a program that we've opened up to the schools for people to go to. We offer both the rapid antigen test and also the PCR testing if somebody should test positive at that site. And so we are seeing a cross section. There's always a potential that the data can be skewed one way or the other, but I feel that when we're seeing all the testing that's going on and being so close to those that are generally considered to be exposed or symptomatic, that we're comfortable with it. The state is also seeing, they have us at 18.1% up through 5 days ago for Kootenai County. And those tests are all the ones going to commercial labs for the polymerase chain reaction, PCR testing, and being reported through our electronic lab reporting. Did that answer your question?
I think so. Thank you.
Jeff, I had a question for you about, we're headed into a holiday, and then on the heels of that, we'll have another holiday. Can you kind of give us what your projections, what you guys are anticipating when we all get back from Thanksgiving, and what that 4 weeks for us in between Thanksgiving and Christmas may potentially look like? Do you have some projections?
Well, you know, we've seen a little bit of surging in the past associated with holidays. Thanksgiving is certainly a holiday where people typically travel, have large family get-togethers. You know, there's encouragement from the federal level on down to the local level to keep things small, to stay at home. You know, for this year at any rate, but it's all going to depend upon how well people are protecting themselves. Social distancing and wearing masks, not traveling if they're sick, or not attending these holidays if they have any symptoms or they've been exposed. I am anticipating that we will see another increase. We're now, it's not unusual for us to see 200 cases come in a day, with some left in the queue. As you know, our data team is now stretched very thin, trying to keep up with all the new cases coming in. We're bringing on new people to help out. It is not beyond the realm of possibility that within the next week or so, especially following the holiday, that we will see 300 or more new cases coming in a day.
Oh, wow. You know, we heard in New York in the summer a lot, they talked a lot about getting to that mountaintop, you know, when they can expect to see that they'll be at the peak of their cases, and then cases start to recede. Do you have any information for us as far as planning purposes when we might get to that peak and get some relief from the increase in cases?
Sure. So let me explain a little bit. It's a function of population density and people interaction. You've heard the term R naught, and that is, you know, the three factors in that are the density of the population, the attack rate among people, which is relatively high with COVID-19, and the duration of their illness. We have well over 2,000 active cases in Kootenai County right now, which is a huge difference from having, say, 200 active cases. There are many, many more opportunities for people to come in contact with somebody who's infected if they're not taking precautions. And so it's much, you know, it's an exponential increase. More people are going to be infected because we have a larger reservoir of active cases to potentially infect them. So, you know, you've also heard the term herd immunity. The herd immunity is that level of the population that is no longer susceptible to being infected. And with the data that we have seen, that needs to be at least between 60 and 70% of the population needs to no longer be susceptible for us to start seeing a reduction based on herd immunity, whether that's through the use of a vaccine to make people no longer susceptible, or through the natural process of infection, which that's not a route that I would like to see us use because of, you know, all the potential long-term harm that can cause to individuals and to communities. So we've also seen wave behavior with this. We saw an initial wave that was, you know, in relation to our current situation, very small and interrupted by the lockdown, which is a good thing. And then we saw a second wave over the summer in the July, August timeframe. And that came back down through the beginning of September, when it started to climb back up in this current wave or third wave of cases. And this current wave has a very steep trajectory compared to the rest of the outbreak over time in our region and indeed nationwide. And it's not showing any indication of slowing down. What is causing those waves is difficult to say, because we don't have a good understanding of the basically the compliance level of folks. We would have to have a significant part of our population either no longer be susceptible, or they are taken out of the chain of infection, whether through social distancing and blocking the transmission, or they're staying home. And I'm not confident that that's going to happen to any great extent, or not at high enough a level. So basically, we have 8,000 people that have been infected or are currently infected in the 5 northern counties. 6,000 of those, a little over 6,000, are in Kootenai County. The population of Kootenai County is, 160 something thousand. So we're not even a tenth of the way there. We're going to have to see more. We're going to have to see more people either infected or vaccinated, fewer people susceptible, for this to come back down to, I want to say to nothing, but that's not going to happen for a while, to a reasonable level. So unfortunately, we're looking at, this is what we're going to see for a while, is continuing infection, and unless something external helps to mitigate the transmission. Sorry for the long-winded answer, but it's a very complex dynamic.
No, I appreciate your answers. I wish they had been a little bit more optimistic, I guess, but I appreciate your honesty.
That was optimistic.
Yeah.
Are there any other questions? Okay.
Jeff, I've got one for you just real quick. So at this point, Panhandle is, because of the amount of spread, you're unable to kind of determine any major events that are contributing to it. It's just basically community spread at this point, and the fact that not enough people are complying with safety protocol.
Yeah, it's the ability to contact everybody who tests positive, to ensure that they understand their responsibility for isolation, the duration of their isolation, then to elicit their contacts and, excuse me, both within their home and in other social networks or out in the community, is a time-consuming process if we were doing all that. And with the number of the volume of new cases coming in, it's, even with a small army, we would have a hard time being able to do all that. So, and this is not just us. We had a meeting earlier in the week with all the health districts and epidemiologists from those health districts around Idaho, and all of us have gone to a more abbreviated approach. We are still contacting all of the cases. We are explaining to them their responsibilities and asking them to notify their contacts. We're also following that up with a letter that to every one of them that also provides the information that we gave over the phone, plus some additional instructions. Currently we're sending a brochure that talks about how to stay safe during the holidays. But what we're not able to do is collect what was happening in the 14 days prior to them becoming symptomatic or testing positive. And so we're not able to identify venues. We are tracking certain critical venues, long-term care facilities, and obviously the hospitals, daycares, and the schools are critical venues that we're tracking along with you folks. But we're not able to track all of the different businesses out there in the community. Hopefully we will see some relief from some of this transmission as the governor has put us back into stage 2 with some restrictions on attending, different, bars and restaurants, limiting the size of meetings, to 10. Hopefully that will have some impact as well. And yes, there are some folks that are actively rejecting the recommendations, but there are also folks that don't realize that they are not maintaining a safe distance. Recently, the CDC came out with the recommendation that or with the guidance, that 15 minutes of exposure time within 6 feet to somebody who is infected has been changed to a cumulative 15 minutes over a 24-hour period. And I don't walk around with a stopwatch for my interactions with my colleagues here at work, or family members at home, or things like that. So it's easy to lose track of time, and people may inadvertently be exposing themselves. And so, as I said, it's a complex dynamic. As I said back last summer, our friends are distance and barriers, and that's not always possible in our day and age. So we will continue to see some spread. I'm hoping that this return to stage 2 will give us some respite, but like I said, the trajectory is not showing any sign of changing at this point.
Thank you. Any other questions for Jeff?
I'd like to thank Jeff for just being at the ready anytime we need him, and has been such a resource for us, and just that relationship, and truly grateful for their willingness to just jump in our meetings and give us that kind of feedback. So thank you, Jeff.
Well, thank you very much. And, we'll be here for you in the future as well. If you, are you going to need me at all during the rest of the meeting, or?
I think we're good, Jeff. Thank you.
All right. You folks have a great day.
You too. Thanks, Jeff. Okay, Dr. Cook, I'll turn it over to you.
Thank you, Chair Morshrow. I think part of what we're excited to talk with you all today about is just the conversation that right now I think we have an opportunity to acknowledge to our constituents, to our families, and to our students, as a matter of fact, that back on October 19th, when we collectively made the decision to kind of modify the plan, based upon feedback that the system was giving us, very valid and relevant feedback, but to move if you recall, on the 19th, we moved the high schools directly into our hybrid model due to some pretty substantial numbers of quarantining and positive cases in our large comprehensive high schools. And additionally, we modified the reopening plan kind of strategy to include a 4-day-a-week approach at both middle schools and elementary schools. And that was kind of a big day for our kind of changing our path. It also created some confusion. I think that is caused a little bit of frustration and concern for our families that we'd like to have that kind of opportunity to start addressing with you all now. We've, if you recall also, that it was just very soon after that, October 26th, or check that, October 22nd, the Panhandle Health District moved our county into red. And so we wound up in this position where when we chose not immediately to move to remote learning, as was written in our plan, that we were a little incongruent with the direction of the health district. And it was if you recall, that conversation was a tremendously thoughtful conversation that we had when we chose those discussions. Since then, we've had some stability. And if you recall, I was kind of pleading that it would be good for us to have some kind of stability. But now we find ourselves in a situation where we've been in this path for a little while. It's a little incongruent with the way the reopening plan was currently written. And so one of the things that we've taken the liberty of doing during that, about 5 weeks, is to start thinking about changing the philosophy, at least to some extent, of the way we're administering the plan. And that is, we mentioned it in those board meetings when we talked about how we would administer them. And it was more of a targeted approach. And we've since then had to make the decision to move the middle schools into hybrid due to some pretty substantial quarantining. And then additionally, we had some cases in 2 of our schools that required, because of staffing issues, that required us to move those to remote for a temporary amount of time. And so part of what we wanted to have with you today is a discussion about how we're approaching that work and kind of show you some of the data considerations that we're sharing and using for kind of strategic planning, and just talk a little bit about what those next steps might be. Trying to continue to provide for our families some predictability and stability in a really difficult time, and meeting those expectations across the board. And we've gotten tremendous feedback that we're being too strict, we're being too not strict enough. And so part of that is getting that conversation kind of tabled up for you to have with us. We'd like to present some data, new presentations of data that we've been collecting. We've got some recommended changes in the language of the plan that we feel like we need to present to you, or at least socialize with you today, and then present probably in the December board meeting, and get some discussion around the data that we've been measuring. And so I would like to, let's start with having Nicole talk through some of the strategies and some of the things that we've been measuring most recently, so that it is helping to inform some of our decision making. And much of this is new data, which I'll also have Scott jump in with Nicole and talk about potentially what we'd be changing on the data dashboard for our website, and then how that informs our decision making as well. But I think it's really important that we highlight that for the last month or so, we've been really doing this in a much more targeted fashion. So I appreciate your guys' time, effort, and energy in this discussion, and look forward to the conversation. So I'm going to ask Nicole to start by presenting some of the data.
Yeah, you bet. Good evening, Chair Marisro, members of the board, Superintendent Cook. I believe we have a chart that will be displayed on the screen. This document, oh yeah, that would be great if you want to click on the 7-day average. I was hoping to start there. Thank you. This document is used or created using self-reported data to the school district. I think it's important to acknowledge that self-reported data means that these are families who have disclosed to us that their student has tested positive, or employees who have self-disclosed to us that they have tested positive. We do not have access to health records, and we are not utilizing data from the health department. So this is our internal system of self-reported. So across the bottom, I think, Steve, if you could scroll down slightly, we can see some dates. Thank you. So across the bottom, we see that this graph starts on August 30th. And 2 weeks later, we start school on September 14th. Then we go a few more days or a few more weeks over, and we see on October 5th, right in there, thank you, that is when we started 5 days a week, school for all grade levels. And then we go 2 more weeks, and on 10/19, we started hybrid for grades 9 through 12. And then on 10/26, we started, so one more, there we go. We started K-8 going 4 days a week. The next spike we see as the week following Halloween. And then at the end of the graph there, we have 11/12 where Nexa went remote, and 11/16 will be in the next grouping where Venture has had to go remote. So when we're looking at these colors, the orange line is the Kootenai County 7-day average daily rate, incidence rate. That's just picked the first day of the week. So that's the Sunday of every week. We have plotted on here for the Kootenai County rate. And then we have blue K5, and we see that our K5 numbers have gone up similarly as the county or community rate has. We have the 6-8 rate in red, and it was similar to the county rate. And then that week following Halloween had a pretty significant spike. 9/12 is yellow, and we see that on October 4th, the week of October 4th, that was a pretty significant spike there, and it was the following week that we went to a hybrid model. And then we see the e-school in green, where we are looking at the self-reported positives of our staff and students, and that rate is significantly lower than both the community and our other schools. I think it's important to note for this data, we'll keep track of this data, but many students, families do not report data to us because they are not in our buildings normally. And so for some of these families, we know what's going on with them academically, and we're in communication with them, but they do not reveal private health information to us. Would you like to do some question and answer on this graph before we move on to another?
Nicole, I was curious when I saw this graph, it doesn't show this week, and we've had a substantial amount of cases this week. So I know as we extrapolate out, especially elementary, it'll probably show an uptick without kind of what you would expect to see when you guys plot this at the end of the week.
I have not individually evaluated this week's data. I would tell you that we have had an increase in cases across the districts and in multiple buildings, but I can't reflect that to one age group over another.
Yeah, I just was kind of looking at the data, and it seemed like we have had a large number of elementary school cases this year. But most importantly, I guess the biggest takeaway from this graph I saw is it's disappointing to see how effective moving to a hybrid was for high school. We see, like you said, you showed us we're above 50, it dropped down, and it's moving its way back up. Do you have any idea or inference what could be driving our high school numbers back up? Is it after school activities? Because this is disappointing. We're kind of finding ourselves back right where we were before we moved to a hybrid. So I was disappointed to see this high school trajectory most significantly.
I think it really models the community rate very closely. When you look after October 5th, it's not parallel there, but those two numbers are the yellow line and the orange line are very close going up.
All right, thank you.
Okay, so I think from here, Steve, if we could look at the monthly positive COVID-19 cases in schools. So this is kind of a history of the COVID-19 cases we've had. Our families will be, in the next couple of weeks, be able to see this table on our website as we are able to roll out some improvements for what we display to the public. And if we scroll down to the bottom, there's just a little bit more, we will see monthly totals of 19 cases in September, 85 cases in October, and so far in the month of November, 114 cases. So we do see that we've got quite an uptick there. This cumulative number of 218 is the number of cases we have seen in August, September, September, October, and November so far. And so it is not our cumulative total, but it is the total for the months of school this far into the year. The document that goes along with this will be our weekly positive COVID-19 cases by school. And so this document would show more specifically per week, which might be helpful for us with your question, Lisa. So the first week in November, we see case numbers by building, and the second, and we are in the third week now, where we see we've had 27 cases. And this data was pulled this afternoon. So Thursday of this week, 27 cases. We'll see if that ends up being 40 in the mid 40s like the previous 2 weeks of the month. We definitely felt the impact of Halloween. Halloween was on a Saturday, and the Wednesday following Halloween was a very big push for us. And those numbers show up in the first week of November with 42 cases. So that was the largest number of cases we've seen so far in the district in 1 week. On the far right of this graph, though, we see, or this table, sorry, we see current active quarantine. So the other numbers in this table are number of cases per building. And here we have the number of staff on quarantine in this building and the number of students on quarantine in this building. And this is the total, I want to go back and check. We are looking at that. This is active quarantine. So this is the number of individuals who have been exposed to someone who has tested positive for COVID-19, and they're being asked to stay home. So these are the numbers of people right now this afternoon. You can see it's well over 700 in the district that are on quarantine. And these are not all exposures in school. Almost, more than half of the students and staff on quarantine in the district actually were personal exposures. So private, outside of school exposures that are requiring them to sit out for an amount of time and wait to see if they develop symptoms. So do we have any questions about those two tables?
I've got a question, Nicole, just on the quarantines. So is that only folks, or does that include the people who've tested positive and the folks who've been in close contacts asked to quarantine, or
no,
are the
that
positives
is not
in addition?
Positives would be in addition to that. So these are the individuals who are in that 14-day waiting period. People who have tested positive are out for 10 days. So these are just the 14-day out.
So total between those is 800 and something, it looks like.
If we looked at the total out of the building?
Yes, that's not right. I'm sorry. I was looking at the next column over the monthly total per school, but that's the number of total cases, not the number of people out right now. So
right.
Thank you.
Okay, so we will look now at the last table, which has a lot of numbers on it. And some of the numbers that you have already seen are coming from this table. So this is one of our spreadsheets that we are auto-populating from information that we take when people self-disclose that they've tested positive or that they've been exposed to COVID-19. And then we triage and give them directions on how long they need to stay out of school and when they can test and when they can return and what symptoms to look for. So we see again that this is presented by building, and then we have the district office and operations at the bottom. This cumulative total of 228 are the number of people who since March have self-disclosed to us that they've tested positive for COVID-19. So that would be, some people over the summer, but not, I would say most people over the summer did not disclose to us. And then we have the current active cases split out by staff and students. And so those are the individuals who are currently out on the 10-day quarantine, or 10 days have passed, but they are not yet well enough to return. So they are out of the building because they're sick. And then we have some percentages associated with that. And I'll talk about what those color coding, the gradient, means in just a minute. The next section, we have active quarantine. So these are the folks who have been exposed to a known COVID case, and they are out on the 14-day. Again, split out by staff and students, and then percentage there as well. Then we have the total out of building, and this is maybe what you were looking for on the previous table, Casey. This would be the total number of people who are out positive with COVID, as well as those who are out on a 14-day quarantine for exposure. And then the next column over, we don't have highlighted. It's helpful information, but these are the staff and students who have tested negative and returned to school early. So if we scroll down in that section, we see that we do have 31 students who have tested negative and been able to return to school under closer mitigation measures. And we also have 19 staff who have tested negative, returned to school, and they are completing a daily denial of symptoms and submitting that to us at the end of their 14-day time frame. The next set of rows over is kind of our completion file. So we have reviewed all of these staff and students. They were at some point symptomatic, or some point exposed, or at some point with a pending test, or at some point tested positive for COVID-19. And so we've worked 1,449 students through this system and 314 staff members. So if we go back to those colored columns, we have indicated kind of some threshold levels at which we would trigger ourselves to begin having some conversations. So if we have, 2% of our building staff or students out positive for COVID-19, that would be the first category there. And it works up to greater than 8% for kind of looking at where some impact, extensive impact is greater than 8%. But there's some points along the way where things should be considered. The second column is the percentage of folks that are out in that 14-day quarantine. So they've been exposed to COVID, and we have like less than 10% thinking we need to be paying attention to this. We have some COVID activity in the school potentially. We have people that are exposed, but we really begin to feel this painfully when it's 10 to 20%, 20 to 30%. And we've discussed, the impact on student equity issues when it's looking at the student percentages, and then looking at resources issues when we're talking about staff out at those higher percentages. So then the third column is kind of a combination of the two. And you can see that these numbers that are reflected here are from this afternoon. And they still show the level of stress that was put on the system at Venture when that decision was made to have them go remote. And then also Nexa has been impacted by staffing. And so these numbers are different now than they were when those decisions were made, because we have had people come off of quarantine, but you can still see that the impact is pretty big for those schools. And then on the bottom of this page in the left, we do have a number of factors for consideration. So when I'm talking about those gradients of color there and moving in those percentages and thinking about decisions that might be, or discussions that might be triggered by those percentage points, these are the types of things that would be discussed in those levels. So timing of quarantine, substitute teacher coverage, operational limitations, if we have teachers out versus if the entire custodial staff is out in one building, it's a different kind of impact there. Indication of in-school transmission. So looking at cases as they come up positive and doing more close epidemiological investigation beyond just identifying close contacts, but looking at if these cases are linked, if they're epidemiologically connected, if they have contact outside of school, if they are part of the same family group, if they have the timing in which they turn up positive, and the cycles of disease iteration. And then also total number of students out of school for quarantine and illness, looking at if we had a surge in one of our grade levels, or if we had a surge in one of our buildings, that would need to be accounted for. If we had a high number of people who were out on quarantine because of an activity and a number of people were exposed, what would that look like? And then the inability to follow through on non-pharmaceutical interventions, the hand washing, social distancing, masking, ventilation, types of non-pharmaceutical interventions we've been hoping for and seeing in our school district this fall.
Thank you, Nicole. Was there more information as far as the charts there that you need to share? That's it?
I don't think
okay. So, Dr. Cook, can you kind of explain, I think what I heard is the two charts that Nicole shared that talked about school cases by month and week. Those would kind of be the new documents on our data dashboard on our district website. And I think what I heard is that this chart that's up currently is more of an internal document that administration's using or planning to use for decision-making purposes in this school by school model, as far as kind of going to 100% hybrid type decisions, or whatever the recommendation would be, I guess. Is that
yes. Chair Marshall,
right?
That's correct. That is correct. And I think I want to throw this over to Scott for a second, just to talk a little bit about what we'd be placing. We'd be essentially pulling down what we have right now on our data dashboard and replacing it with the first two documents that we shared. But before I give it to Scott, I do want to talk a little bit about this document. This is a document that is a tool that we'd be using to make some decisions in real time, and it modifies quickly. It changes a lot. It's a very dynamic document, and it gives us the information that's going to help us start to see some things a little quicker. And so even the shaded, the gradient kind of legends are still a work in progress. I don't want anyone to think that we've gotten this so tightly dialed in that we know exactly where those thresholds are yet. We're just doing the best we can to navigate that. And after Scott's finished, I'd like to have a chance to kind of elaborate a little bit more on how that model is kind of playing out in real time and talk that through just a little bit. So I'll kick it over to Scott to talk about the kind of the forward-facing piece of this on our webpage.
Thank you, Dr. Cook. Yeah, I think that the existing dashboard served its purpose in the early weeks of the school year, but as we've seen the numbers rise and accelerate, it's become fairly unwieldy and maybe not as useful to our families in terms of seeing the bigger picture of what's happening. And so with the two tables that Nicole walked through with you, one for the due positive cases by week, and then the other where we're organizing it by month, I just feel it's going to be a lot more useful display of this data. People will be able to see the trends and the cumulative totals by school, and I think we can build in by level between the elementary, middle, and high schools, and then the district totals as well. So having that rolling 4 or 5 week view, being able to go back month by month to the start of the year, I just think this is going to be of greater use to our families. So our expectation is that we would take a snapshot of that roughly at the same time every day and update the website with those 2 tables and roll it out, I hope, sometime next week during the break.
Thank you, Scott. I think the thing I would want to emphasize is if you migrate back to the day that the county moved to red and the district chose not to put all of our schools into remote learning, and started to approach it from the lens of how have we been administering our plan. We wrote the plan in the summer when we had the best information we could get as a risk model. In fact, it's even titled a risk-based plan. And now what you're seeing is the way we're living in that model is doing our best to kind of approach it from a targeted, kind of almost case-by-case basis. And there's really 4 criteria that we've kind of presented, and I just want to summarize them. Number 1, we have to be highly attuned to staffing circumstances. When the adults are out of the building, either because they're positive or because they are quarantined, it makes it quite difficult to pull off teaching and learning to the expectation that we would have for our district. The second one is the number of students and staff that are in quarantine. It very quickly becomes an equity issue. Our ability to deliver those services when there's large numbers of folks in those circumstances also becomes a frustration for, I think, the system. The third one is that internal view of kind of the incident rate of the levels is kind of the way we're looking at it. Currently, that graph that we led off with that Nicole kind of walked you through shows the incidence rate of both students and staff at each level. And I think we're going to try, if we can in the very near future, to segregate that out into 2 separate data sets, but we're working as fast as we can right now. So we'll get there. And then the last one I think that is so critical because it's been the last factor in both schools that we've had to take direct action on, that we'd have to move into distance learning, was what I would call is operational resiliency. And it's quite simply when we run out of the staff that are helping us maintain that level of delivery. Some staff have a different amount of impact in the overall building. It's pretty easy to get a sub for a teacher. It's not necessarily always easy to get a sub for custodial right now, or a sub for drivers. As you guys know, that bus drivers are so hard for us to come by. She doesn't know I'm going to say this, but I'll just tell you this right now. We're writing our 14 nurses through this year. If we were to lose our nurses in any way, shape, or form because of either positive cases or quarantining, we wouldn't be able to pull this off at all. And I'm not saying that so that you guys will love on Nicole and her team at all, but I'm saying that because it's that critical of a factor in how we're doing this. Our ability to contact trace and our ability to stay congruent with the expectations of our protocols ride on their shoulders every single day. And between their delivery of those services and Scott's team to communicate those things to our families, those are critical infrastructure pieces that we've built in the recent past to help us stay successful. And so I think it's important for us to make sure those delineations are clear. And I think one of the things we're going to talk about over the next few weeks, I would assume, is how we would modify our reopening plan to reflect those values. I can tell you as a superintendent, you don't make decisions without knowing what others are doing around you. And I can tell you the day that the county went to red, I made dozens of phone calls and quite frankly was a little disappointed to think that if we would have moved to remote learning as the plan called for it, we would have been the only entity in the entire community that was in somewhat of a shutdown mode. And I have expressed those frustrations to some leaders in our community and at the state level. And I just want you to know that we're working hard, very diligently to try to provide a balance between health and safety and wellness for our kids and staff while they're in class, but also meeting the needs of families' mental health, their social emotional well-being across the system. So I think one of the things that we wanted to make sure of is that we had an opportunity. Well, let me pause there, see if there's any questions first.
I don't know so much I have a question, but just a comment about the charts in general. I appreciate them very much. And I think Scott said it well that kind of the old way of reporting on the website served its purpose, but it's perhaps run its course. And I personally I found the new documents more impactful in the current situation. And there were things that surprised me, I think, as far as looking at certain buildings that in my mind, we get those updates every night as trustees, but in my mind, some buildings had less significant or less quantity of cases, and others had more than I thought in my mind by not seeing it in the chart form. So I very much appreciate those. I think for me, since we've kind of looked at our 3 levels of schools separately, being elementary, middle, and high school, it would be beneficial for me to see them grouped that way on these charts. That's kind of the first thing I did, just as I looked at elementary and tried to figure out, okay, how are what's going on in our elementary schools, and you're kind of jump all over the page here if you're trying to do that by level. So that would be my only ask or suggestion, but I'm super thrilled with what you've put together here.
I agree with Casey. I did the same thing though. I was jumping back and forth because I'm very interested in the K-5 numbers. And so having that broken out would be really helpful. The original chart with the lines that Nicole presented was helpful in that regard. And I find the whole thing to be very well put together, and I appreciate all the work and all the effort.
Yeah, I'd like to say thank you to all the hard work that went into providing this. I think our community is going to be so happy to be able to see this data. I think for me also, along the lines, it would be easier to see them grouped together. But also, I think what you can see now for the first time is that last chart that Nicole, that you mentioned, the percent total out of the building between staff and students. I think we kept, seeing more cases at high school and middle school because they're larger facilities. And so we maybe undervalued the smaller number of cases reported at our elementary school, but they're smaller facilities. And so each school itself is going to have a smaller number of cases. So to see 5 positive cases at Canfield, it was wow. But it's in relation to the actual number of staff or students they have. And so to see them lined up like this, it really does give you that perspective that we didn't have before. So thank you.
Chair Mersrow, if I could just give a shout out to Leanne Bullomar. She's our nurse who was acknowledged this week for being bilingual in computers and English. And she has worked very hard on putting this together, and we really appreciate her efforts. We're all learning a lot this year, and she has learned a lot in Google Sheets, and I have benefited from it, and clearly our community is too.
Yes, thank you, Leanne. Nice work.
So Chair Marshall, if I may, I think one of the last pieces that we'd like to present to you guys today is Dr. Roscoe has been quite actively discussing and working with our elementary principals and our teachers. Our elementary teachers, all of us have been discussing that with them. I think the thing that is important to note, and I'll just say it, we've received a tremendous amount of feedback. Please consider going to hybrid at the elementary level. We've received a tremendous amount of feedback. Please do not change status at the elementary level. And so we've been having that discussion now for quite some time. And I would like to give her an opportunity to report to you kind of some of that information and maybe just discuss that for your guys' consideration. So Dr. Roscoe, please.
Thanks, Dr. Cook. Hello, everyone. I think Steve said it well. We've been bombarded with information, with letters. I'm sure you're aware of it. I'm sure you have too, reflecting a variety of viewpoints about returning to a hybrid model. We spent a lot of time on Tuesday morning, the elementary administrators and I spent a lot of time talking specifically about this. And I asked them to give me their strongest assurance about what most of their teachers in each school believe about 2 days or 4 days. Because Steve and I have been in these listening sessions at different schools, and we've heard teachers talk to us personally. We know they may say something to us that they might say differently to their administrator or to their colleagues, and our administrators are swimming in that kind of culture at the school about what they hope for. And as you know, everybody's worried about safety and everybody's worried about health. They're all concerned. And there are 2 schools of the 11 schools. I didn't ask for survey results from eSchool for obvious reasons, but there are 2 schools that had said that Fernan, being one of them, Kathy suspected about 2/3 of her staff would like to be in 4 days, and then maybe about 1/3 would like to be back in 2 days. Bohr is another one where staff, most but not all staff, roughly 3/4. This is not scientific data, and I don't claim it to be, would like to be in 2 days. All the rest of the schools said that the vast majority of their teachers prefer 4 days for their students because of what they're seeing in the differences in terms of academic and social and academic learning losses that occur and social and emotional wellness that's so imperative when they're together and when they're with each other. It was pretty stunning. Frankly, I didn't know what I was going to get when I asked the principals. I really didn't. We've heard so much from so many different people. And I think one of the things that stood out to me the most was that when teachers were describing part of the difficulty when kids are there 2 days, they fully admit that when you have 14 children or 12 children in your classroom, and you can really devote time and energy to the relationship with them, to their sense of social emotional wellness. With 12 kids, you can really you can do a lot of work that is obviously more powerful. And they said, but that doesn't account for the other 3 days than when the kids are home. That there's still this differential that they described. And they said part of it they recognize is that despite their understanding and their growing sense of ability with Schoology, it's still extremely difficult to meet a curricular need for children when they're at home for those 2 days, plan on Wednesdays, meet the needs of the kids who are right there in the classroom with them, and then also address the needs, which are actually very different for the quarantine kids, because it's different because they're not receiving that same experience as you would in the classroom, right? They said, they described a sense that what they kept saying is, it's that we feel like we can't do our job well. We just can't do our job well. And we got talking a lot about what that means then what happens if we return out of reasons of safety, if we return to a hybrid model. And I think clearly there are families in a hybrid model where there are households with greater connectivity, higher levels of parent education, greater availability of parents for time for engagement, more materials and books at homes, where those kids will do well with 2 days. And we've seen it, right? We've seen it last spring. There are lots and lots of students that our teachers believe will not do well. They'll try, families will try, they'll be scrambling to figure out what to do with daycare, to get back to work, to make it happen. But I can't express to you my grave concern for families who don't have all the answers and who can't figure it out. And I think even more importantly, when I think about the burden of proof, like the proof on us to prove that if we keep kids in 4 days that they'll be safe, I think there's also a burden of proof that I feel certainly personally like I have a burden of proof that says if we go back to a hybrid model, can we be certain that the children will be more safe when they're not in school together? Do we know that they'll be in childcare facilities or in homes where people will mask or people won't have people won't spread the disease or there won't be transmission. I frankly don't have a tremendous amount of confidence in our community's ability to stand with us and to stand with us and create safety measures. I see, and I'm concerned about that. And I think our administrators and our teachers are concerned about that as well. We already know from some experience when we send our children to different child care facilities, how difficult it is for them to offer them the learning that they need and also to offer them the safety precautions that are necessary to keep transmission of the disease to reduce that while they're out. So I think those are my, certainly I feel confident that I'm representing our teachers' opinions in general pretty strongly, and I feel as worried as our trustees do about the safety of our kids, and I'm also exceptionally worried about their social and emotional well-being and about their academic losses, that learning index loss of kids when they are not in classrooms. I think it's significant. And I think finally I want to say that I trust all 5 of you, and I think I'm probably standing in line of another several hundred people who say, thank you, and I would never want your jobs right now. And that's how I feel. And I trust your collective opinions. I know it's not easy, but I think hopefully that's information that will help you.
Thank you, Kate. Yesterday at negotiations, I talked about Kate's kind of calming, smooth, kindergarten voice is what I called
You
it.
called it a kindergarten voice. Yes, you did.
And I told her I missed it in the negotiation room with us. I needed it a few times. So thank you. Dr. Cook, maybe before I hand it off to you, I just looking at the time, it's about 4:11. And so hopefully in 20 minutes or so, Rebecca and I can get moving. I think a couple things just to maybe bring the conversation back that are important. I think we've learned as a group, as we've learned on the go here, that it's hard to plan for too far in advance because things change rapidly. And not only advice and metrics and all those sorts of things, but even the conditions within our own community. Early on in the summer, we looked to kind of have some real stable experiences in our schools, and we've changed a little bit for that. And our parents have been pretty patient with us on that, but we've missed the boat a few times on some of the predictability that we've asked them for. What I heard from trustees as far as setting up this meeting was just maybe to focus on that a little bit and try to come out of this meeting of okay and look at it in small chunks. So what's school going to look like from the Thanksgiving break to the winter break? So for those, I believe it's 3 weeks that we're back. And I'd like us to focus in on that. And then as we move into our December 7th meeting, the week after break, hopefully use that meeting to talk about what's it going to look like after winter break, maybe through the end of the semester. And then I'd like to see maybe some talk at the December meeting also of any kind of recommendations you guys are going to make on second semester and little tweaks to, bell schedules or cohorting or whatever it's going to be. So we start talking about what second semester going to look like also if we're going to make changes. So that'd be my ask is if we could start tailoring the conversation really today to focus on, we've made it to break at elementary. We have one more day at our secondary schools. But what's it going to look like when we come back on November 30th until whatever it is, December 18th or 20th, somewhere in there.
Yeah, I think I would just jump in on that and say, first of all, we would be strong proponents of some kind of predictability on this. And I think that's one of the reasons when we moved the middle schools, we tried to give a notice, right? By saying we're going to move to hybrid after Thanksgiving break and then hold on and hope you can get there. And I think that's kind of the conversation we're thinking with whether or not there's going to be a change made, that we try to do our best to stay within a change and live by that. Now, when we don't necessarily administer it to the entire system, and we start doing this targeted or case-by-case basis, it can turn on a dime. We had one event, excuse me, we had one event that made all the difference in the world at one of our schools, and it can happen that quick. And so the trade-off for an issue like that is just depending. I mean, there's a lot of cases in our community right now, and it could impact any one of our schools to the extent that in 24 to 48 hours, we have to make a dramatic change into a distance learning mode. But I do think that trying to build some continuity and expectations is what we've been striving for all along. And it has been a challenge, to say the least. And so I respect that, and I agree. I just hope we can deliver upon it. I think that's part of our struggle, is that not so much of this is out of our control, and the community, what's going on in the community influences what happens in the schools.
Yeah, it seems, at least at kind of our trustee 30,000 foot level, that the decisions at Nexa and Venture were well received by their community. And well received might not be the right word, but they were at least understanding of those, and those were both made on short notice. I would think it's probably important, and I'm sure we've gotten the attention of folks across the system, but if we're sending communications out, that we just let them know that we are looking at schools on a case-by-case basis when it comes to closures, and that those could happen with the amount of spread we have in our district or in our community. Those could happen on short notice, like we've seen with the two schools thus far. I'm assuming, you know what they say about that, but I'm assuming, especially with the action taken earlier today on the middle school decision, that we view the high school and middle schools in continuing, at least in that 3-week period from Thanksgiving to the winter break, in the hybrid model. And I think we've communicated that out, or Dr. Cook's communicated that out to our community. But I assume the last 15 to 20 minutes of our conversation here should be focused on elementary and where we're at there. Obviously, we heard from Dr. Orozco and Dr. Cook. I don't know if you have more to add, or if administration has a recommendation in that regard, but why don't we have that conversation and let everyone go. Do you have a recommendation? I think I saw you shake no, but.
No, not at this point. I think this is, no.
I think one quick question I have then for you, Dr. Cook, is, and we've alluded to it some in these documents and everything, but one of my big concerns is just the pressure on the system right now. And there's a lot of different pressures, and we can see the data and the numbers and all those kinds of things, but there's also another layer of just pressure and where is the system functioning, and where does it need maybe an alleviation a little bit to get us maybe through to Christmas. Does that make sense?
It does. I think the thing that I have two kind of foreboding concerns, and that is the getting beyond, you saw in the data the impacts of what Halloween caused, and we anticipate that going through Thanksgiving and going through Christmas could be a challenge. We've got, I guess you could, to some extent, we could say we have the benefit of the entire Panhandle Health District mask order that was delivered today, that I think could provide some measure of hope. But we are definitely concerned about the impacts of folks being in large groups because of the holidays and folks traveling and those things. And I think, if we were to say, for example, hold status quo where we are right now at the elementary schools and the middle schools, I don't anticipate that I can have any ability to guarantee that any of those levels would not be still impacted based upon those decisions. And we may have to make school-wide decisions, school-by-school decisions, we might have to just come back and say, because of operational limitations and the fact that we are, I'm going to say it one more time. If we have issues with our nursing staff, our ability to contact trace and to keep the system functional is completely compromised. And I will say to you, I recommend we go to remote learning, because we cannot guarantee that at any given point, we're not walking into just a hot mess dumpster fire. And so, but at this point right now, we've had, I think the day that we had, I think the highest total we had was 18 total cases one day. And that was the absolute stretch of our ability to function to the extent that we could deliver upon it. If we would have had 5 or 6 days of that kind of activity, I'm not certain. And Nicole, if you would like to jump in here, if you think that I'm even stretching it too much, I'm not certain that we would have been able to handle a stretch of that. And I think that's the critical kind of position we're in right now, is that, you know, we've got schools that have had 1 or 2 cases total all year. And we've got schools that are approaching 50 cases since the beginning of the year. So Nicole, can you add to that at all?
Sure, Dr. Cook. I think you're spot on with that was the absolute limits of where we've been. We also are making system improvements right now. I mentioned earlier, we've learned a lot since August. We know a lot more now than we did when we started this. We are rolling out improvements in our internal tracking system that should save us workload and a lot of just overall improvements in the details that will be fully functioning after Thanksgiving. I am concerned. November 30th is a Monday and we've missed a week of school. I think it's highly possible we could have 50 or 60 cases reported to us on that day. That only seems doable because we will not have large amounts of close contacts who need to be notified for quarantine because we've been out. So it sounds like a heavy push that we haven't done before, but I also think it might be possible. And I think that we'll continue to see those numbers go up the week after Thanksgiving.
Nicole, this is a question for you or for Dr. Cook potentially. You know, after looking through the data, and I really appreciate the spreadsheet that kind of has the light blue, dark blue squares. I think it gives valuable information. The part that I keep coming back to, and I think that's where I'm frustrated with how we're approaching elementary school now, is I think if we all looked at Winton and Woodland, for instance, and went to the percent total out, I think that is a good chart because it kind of shows us staff and students combined. There's no difference between Winton and Woodland in their metrics right now, but the approach that we're going to take on keeping that school open is vastly different. And what we're not providing our elementary students is social distancing. And I'm all for keeping schools open, but after touring classrooms this week, I saw crowded classrooms and, you know, conversations with teachers. I heard something a little bit different than what Dr. Orozco said today, and it was worry of crowded circle times and close contacts. And so I wonder if what we're hearing every day in the news and what our parents are hearing, what we know from our local, state, and federal health officials, is there's really 4 things we can do. We can wear a mask, we can social distance, we can avoid indoor crowded spaces, we can reduce occupancy in those indoor crowded spaces, as what the athletic decision was, and not allowing spectators at athletic events. And we can wash our hands. And we're failing to do that at the elementary school. And we heard from Jeff that our metrics are not headed in the right direction, that December could be a very difficult month for our community, our hospitals functioning at capacity. And I think it's very likely that our elementary students are the least tested of all of our populations and probably reflecting the least amount of COVID activity by the nature of their age and how they manifest the disease. But what you can see from the data that you provided is that the teachers are affected. They are getting sick. They're coming into contact. And so I just wonder, you know, we look at Bora and Brian and their metrics are better than Canfield's, but yet we're moving Canfield to a hybrid. So in my mind, I just can't rationalize why we're making one decision for 2 cohorts of students and we're not allowing the same for our elementary students, because they will continue to be at risk in the next 30 days. And I wonder if the best Christmas gift we give our district and our staff and students is not having a 7-year-old on quarantine. And by having students together, we can see that one exposure in an elementary school classroom can result in 12, 15, 16, 18 exposures. That's 18 little ones who have to quarantine, and that is a difficult load for a family. I'm all for keeping kids in school. I'm not suggesting that we move to a hybrid. I'm begging us to pivot and preserve as much instructional time as we can during the next 4 to 6 weeks. And it seems obvious based on the data, what we've learned from our high schools, our middle schools, is that when we see increased disease activity in our community, we see increased cases in our schools. And that is not going to change for the near future. And so why aren't we being proactive and muddling through this and hoping that our community takes action and we can reduce transmission and disease activity in the next 4 to 6 weeks? But closing school with 1 day notice, for Nexa or for Venture doesn't seem like it's a proactive approach. And so I do worry that we're setting ourselves up to be in a worse situation after Christmas when we have the ability to pull back and be proactive and use every measure that we're being told every day by every public health official. And it's listed on here under mitigation strategies: poor adherence to non-pharmaceutical interventions, number 8. I think we have that when we're not social distancing. So if we want to keep schools open K5 4 days a week, then we're going to have to find a way to spread them out and stick to it, because shoulder to shoulder is not working, as evidenced by the data that we shared today.
Yes, Trustee May, I would like to say that I agree with much of what you've presented, but I would like to acknowledge that on the week of November 18th, you see in the 7-day average daily incidence rate, 6.8 was significantly higher than the other grade levels. And I do believe that that was the week where the decision was made to change the method for 6.8, as opposed to the data that you're looking at is accurate in real time for today. And you are right, those percentage impacts do not show a great discrepancy between Winton and Woodland. And that is the activity with today's data, as opposed to the data that was present in this spreadsheet last week that was driving decisions, conversations that occurred at that time.
Right. I think that's what worries me, Nicole, is that we're going to continue to see increased disease activity. And our elementary population will always be the most under-tested, probably, and the most under-diagnosed based on the nature of their age and how they manifest the disease. And so I worry it's an environment for our staff that will be difficult to keep them healthy if we're not social distancing and we're not reducing the occupancy in these classrooms. 35 students, as we heard touring around, could potentially be sitting in one classroom for 8 hours. That's a lot. It's a lot of exposure, and Jeff went over that it only takes accumulation of 15 minutes within 6 feet. That's pretty easy to achieve when you're in the same classroom for 8 hours. And so I'm just, pleading, saying, can we do something to preserve instructional time? And when students are on quarantine or staff are on quarantine or they're sick, in the worst case scenario, we're not preserving that instructional time. And so I worry that the writing's on the wall again. We tried it with high school and we had to regress. We tried it with middle school and we had to regress. I'm not sure how it will be any different with the amount of disease prevalence that we have at elementary school right now.
I look at it with a little different lens. I'd rather see one school shut down than 11. I think it's a matter of weighing risk, but it's not risk of catching COVID, and it's not even the risk of dying from COVID. To me, it's an overall risk that has a very wide gambit. And when I hear today that social and emotional wellness can't be maintained with 2 days a week, we can't do our job with 2 days a week, lots and lots will not do well with 2 days a week. I have to balance that. I have to balance that against what is best for our kids. And when I weigh risk, the risk that I'm hearing to our children if they are not in school is not being outweighed by the risk of the disease being passed to a child or to a teacher at this stage. Because everybody's fear is death, and that's a risk, but I can't protect every teacher from that risk. They get in their car and they're more at risk, frankly, of dying in a car accident than they are of dying of COVID in their classroom. This is a matter of us looking at the entire gambit of what is affecting our children and what is best for our kids. And as a trustee, it is not to weigh this community's risk factor of catching COVID. It's to weigh all of it. And what I'm hearing today is our kids need to be in school 4 days a week because there's more at risk for their lives and their future than what COVID is presenting today.
Yeah, Jen, let me clarify something, because I think you maybe misinterpreted what I said. I'm not suggesting in any way, shape, or form that anybody close schools tonight. All I'm suggesting is that we need to take every precaution that we're being told, and that includes social distancing. I would advocate for us keeping elementary schools open if we can more appropriately social distance. So I would like to clarify that. It's exceedingly important. I'm not at all suggesting that we close schools, but we need to take precautions that we know mitigate transmission and mitigate risk of exposure. That's what I'm discussing.
But I think your solution is to go to hybrid, Lisa. That's the bottom line. We can't social distance in our elementary classrooms. We all know that. So to advocate to say we have to social distance is to have an alternate plan, which is only hybrid or remote learning where nobody's in classrooms. And so I'm not sure how I'm supposed to interpret what you're saying by saying we have to social distance, but not go to hybrid. And if I'm misreading that and you're not advocating for hybrid, say that.
No, Jen, what I'm advocating for is there's a tipping point in disease activity in this community. And I'm not sure at what point are we going to say it is no longer safe to send our kids to school. When will that time be? When the hospital no longer is accepting patients, when we have teachers and staff that ultimately become sick? What point is it? All around the country, we're seeing schools regress. And there are very few schools that are sitting kids shoulder to shoulder in full classrooms with the amount of disease activity that we currently are experiencing. So I'm not suggesting that we do anything different other than follow the guidelines that we know work to prevent transmission. And that is a Swiss cheese model that Nicole has done a great job of describing to us. And social distancing and reducing classroom capacity or occupancy is integral in that piece. So maybe it's time we think outside the box. Maybe we prioritize those students who truly need to be in school, and we find ways to provide safe classrooms. That's all I'm suggesting. If we're going to get through the next 4 to 8 weeks, it's going to take thinking outside the box. Otherwise, we're going to have a rolling cycle of schools closing, and that's not in anyone's best interest. We know how this disease is transmitted, and we know what we can do to prevent that. I'm saying we must do everything we can. Why are we not allowing visitors or parents to watch at sporting events? Because we're worried about indoor closed spaces. I guess, why are we making those decisions, but then we're still filling up our classrooms? There's so much inconsistency in the approach to this disease process right now. I truly understand why parents are frustrated.
Because mental health and quality of education are not dictated in a gymnasium. That's why.
Thank you both. For me, I look at numbers, and so I look at it in a little different lens. Looking at, we have 11 elementary schools. There's 5 of them that have 0 student cases, according to this data. And I know it's not up to date today, but that's close. 5 with 0 current active cases, 2 with 1. If you look at staff, there's 3 elementary schools out of 11 with 0 cases, 4 with 1. And that's where I struggle, is how can we impact a school and close a school of 300, 400, 500 students because they have 1 case. And some of those that's the only case they've had all year. And I guess that's the struggle for me, that we know the impact that a hybrid model has, particularly on the younger learners, K2, K3. How can we justify reducing their seat time in the classroom, cutting it in half over 1 case? And I get that could change rapidly, and I think that's something we monitor, but that's what I struggle with right now. And today, I can't justify it. And I can look on here, and there are some schools, Bora, Bryan, Sorensen. You can look at them, and on that colored document, they're in darker shades on all those. And maybe kind of short-term mitigations of a hybrid would work at those schools. I'm not so sure. I guess I don't know the answer to that. And I'll say the 0 and 1 cases, that's with, as Lisa says, 35 kids packed in classroom shoulder to shoulder, which I know we're not doing. We don't have classrooms with 35 in it, but regardless, they are not socially distanced. The other concern I guess I have in regards to staff, and I think we could say this for our community at large, is the majority of the cases that have been in our buildings, at least what's been reported, and I'd love to hear if we know different, but they haven't happened within the school. They've been as far as we can tell, happen out in the community. And as a community, we are not practicing the protocols when we're out in the community. And that's where we're seeing the majority of transmissions. So that's where I'm at. Today I could not support moving elementary to hybrid.
Tamara, you want me to go? Everybody has said things that I 100% agree with and could go either way. Kate, I agree with everything that Kate has said about social emotional learning and the things Jen, you just said about that as well. Lisa, your points on community health, all of it. We all weigh and carry all of it. For myself right now, I'm looking strictly at the time right after Christmas, right after Thanksgiving until Christmas. That's what's in my head right now. Rolling closures during that time of a time at Christmas time that is stressful enough. I'd rather go into that time knowing exactly where we're at. I don't want rolling closures during that time. That's just me. I'd be a proponent of hybrid right now at the elementary levels as we move into just looking at the time from post Thanksgiving until Christmas. We know that there'll be a spike again right after Thanksgiving. We've seen it, we can assume that. And so I'm just picturing myself in the middle of December and that spike. How do we navigate that from an operationals standpoint? That's what's weighing in my head right now is the operations of moving through that. So so no matter what we decide though, I hear everyone want that to be said. So
I hear everyone as well, and yes, that 3 weeks, that we've got, but for me, I like how we're doing in the direction we're moving, taking it case by case. I can't see moving to hybrid for every single elementary school when we don't need to. It's not necessary in many of our schools. So that's kind of where I sit right now. And I know that you two need to probably get going because we're past our time.
Chair Marshall, if I may, one of the things that we have heard substantially with parents who are currently frustrated with the status quo at the elementary level and feel like they should have some option, feel almost to some extent that we have not been honest with them because we did change the plan that we originally designed back in July. And I think that some of the feedback is fair and reasonable. We have, provided and are willing to provide for families that do not feel like it's safe for their child or they're comfortable in these circumstances for whatever concern that's related to COVID or social distancing or even masking for that matter. This is an exceptional year. I can't even begin to describe how exceptional it is, as you guys all know, that we would be willing and are willing to honor extended absence requests for folks that choose that they're not going to be able to participate in this, in whatever decision we make, and they just want their kids away. I am a little nervous about the window of time between Thanksgiving and the holiday and Christmas holiday. And so if folks are interested in that option, that's one thing that we can offer them. It's not an online offering. It is essentially just, we won't turn you into truancy if you choose to step away for a little while. For those folks that feel like that this is not a good place for them right now. If they're interested in that, it's policy 3040 and it's procedure 522P. It's on our website. You can find that by just requesting that information.
Dr. Cook, our viewership is not huge today. So is that something you plan to communicate out?
We will, yes.
Okay. And how about, to me, there's a couple of things. self-disclosure, and earlier Nicole talked about self-disclosure, and that's kind of the model that we're living in as far as positive tests. Has that been the case all school year? Or has that changed as, with the increase in cases and Panhandle's had more difficulty with managing that?
Yeah, Chair Mersrow, that basically has been the case since we started this adventure. We have always been ahead of the health department in contact tracing, and we continue to do so. At some points this fall, we did receive communication back from the health department regarding positive labs and some very, very minimal quarantine notices, but almost all of them have been after the fact, and we were confirming really with the health department that we had the same dates. So we've been able to continue operating as we did before, even though the health department has now had a surge and is unable to share that information with us.
Thank you. I would think that would be important to make sure people are aware of that, because I think there has been some misunderstanding on that. I know, and Dr. Cook and I have talked about that, and I'm sure we've all heard cases of that. So as we're communicating out, I don't think it's unexpected here that our opinions vary, because I think we're reflecting our community, and the community in the country is varying in opinion here. So we do need to wrap up. So if we have some kind of closing things, Rebecca and I need to get going. Anyone? Lisa, I see you unmuted there.
Yeah, I guess I would just kind of like to close. And I guess my frustration, maybe the piece that's frustrating for me that we're not acknowledging, is that we can't control how the course that our community is taking. We can't control that now we find ourselves in a situation where we have uncontrolled, mitigated spread of COVID-19. That's something out of our control. But what we do have is our school community and our Coeur d'Alene community. And there's not a firewall between schools and the community. And so what we are doing at schools is going to affect the community. And what we're being told by our governor, and like I've gone through it, every health official, is we must do our part. And I think that's my frustration, is that I'm not at all suggesting anybody decrease instructional time, but we have a responsibility to do our part to get through the next 4 to 6 weeks. And our part is to take every mitigation strategy we can and apply it. And I'm worried if we don't, our two communities will intersect, and students, maybe they'll be asymptomatic, we'll bring it home to families, families will bring it back, and ultimately it's our staff, it's our bus drivers, it's everybody, it's our community that will be affected, that we're not taking every measure we can to aggressively fight the situation that we're finding ourselves in. And I think it's unfortunate moving forward. And I think the next 4 to 6 weeks for our school community will be hard, and it will be even more difficult for our community, Coeur d'Alene community.
Okay, thank you, Lisa. Anyone else have anything to add before we wrap up here today? Okay. Thank you again, Dr. Cook and team, and Nicole and team on the charts, and appreciate your work today. And we'll talk to everyone soon. Be safe.